Doctors at Brisbane's Princess Alexandra Hospital have used a neurosurgical technique pioneered for sufferers of Parkinson's disease to help a young stroke victim. The 22-year-old woman developed a severe tremor that would have been permanent until doctors put a probe into her brain and destroyed a tiny part of it with heat.
For Milissa Valentine, just walking down this hospital corridor is a triumph of determination and modern medical science. 2 years ago, she suffered a severe stroke that left her speechless, completely paralysed on her left side and in a wheelchair. As she recovered, she developed a disabling permanent tremor, which her neurosurgeon has been able to fix instantly with a delicate zap to the brain.
We put a probe down into her brain. We started about 5 millimetres above our target and we started stimulating the brain.
When they were sure they'd found the overactive tissue that was causing the tremor, they heated it to 80 degrees for 2 minutes.
We put a burn here, and the tremor for Milissa has gone, which we're delighted with, absolutely delighted.
The medical team use a sophisticated computer navigation system to map the brain. It shows them exactly where to look for the cells that need to be destroyed. The brain feels no pain, but the patient must be awake throughout the operation.
I was a bit apprehensive, but I got over it.
The young pharmacy assistant faces months of routine therapy to regain the strength of her left side, but she's hoping her case will benefit other young stroke victims. Meanwhile, she's looking forward to something she hasn't been able to do for 2 years.
I have a manicure. I haven't had it yet.
Doctors believe she's the youngest patient to be treated by a thermal lesion, but they're expecting the procedure to become more common in the next 12 months. Karen Berkman, ABC News.
A young stroke victim from Brisbane has been given a second chance at life. Milissa Valentine is one of the youngest patients in Australia to undergo a brain burn to restore movement in her limbs.
This is Milissa Valentine today, a life-loving 22-year-old who can't wait to travel overseas, pursue her career and
have a manicure.
But 2 years ago things were very different. Milissa suffered a deep stroke. She couldn't move her left side and after a year developed a disabling tremor causing her arm to shake uncontrollably. Simple things like drinking, writing and even dressing were impossible. But remarkable brain-burning surgery, usually performed on Parkinson's disease patients, turned Melissa's life around. Neurosurgeons from the Princess Alexandra Hospital put a probe into her brain, targeted the area causing the tremor and interrupted it.
We did a test burn and there was no problems, the tremor had gone, so we made a permanent burn.
Amazingly, Milissa was awake during the complicated procedure.
I was a bit apprehensive, but I got over it.
Melissa's independence has now been restored.
She's just telling me she's going to go and visit New Zealand.
Dr Olsen is now looking at ways of improving the quality of life of other patients with even more disabling brain disorders.
What we're planning to do for people with bilateral symptoms, and there is a lot of them, is that we'll be looking at putting a burn on one side and then a stimulator onto the other side of the brain.
Alicia Gates, 7 News.
A young stroke victim has been given a second chance at life after doctors managed to stop the violent arm tremors caused by a stroke. She's believed to be the youngest patient in the country to undergo the delicate surgery where the doctors burned part of her brain.
Imagine shaking uncontrollably, unable to do simple things like write or dress yourself.
And just touch my finger with your fingertip.
Task that'd be a cinch even for a toddler, impossible for Milissa Valentine, a stroke victim at just 20.
I basically couldn't use this arm. It was shaking too much.
Her eye drooped, and if she could open it, she had profound double vision.
The tremor, similar to Parkinson's, developed a year after her stroke and lasted 24 hours a day.
Just put your arms out in front of you.
The only hope was delicate brain surgery, surgeons burning the malfunctioning nerves at 80 degrees while she was awake.
This is a sleep while we drill a hole into her skull and we open the lining of the brain. After that, the brain does not have any pain fibres.
Guided by a GPS-like navigation system, doctors then used a probe to blast the damaged area.
We did a test burn and there was no problems. The tremor had gone, so we made a permanent burn at our 2 locations.
The results immediate.
No more tremor.
A medical miracle. She now has amazing dexterity.
Touch my finger with your fingertip.
Total control once again. Melissa's recovery is far from over, but doctors say in time her speech will return to normal, and she has a dream to go trekking in New Zealand. There's one urgent priority.
Have a manicure.
Melissa's amazing transformation will go down in the medical history books.
It all looks good.
So young and so brave. Lexi Hamilton-Smith, 10 News.